Stimming, a behavior often found in people with autism spectrum disorder. It's what we're going to be talking about as we highlight Autism Awareness Month with our guest, Dr. Kerri Krauss of New Horizons Therapy, and Dr. Zahra Hajiaghamohseni, a board-certified behavior analyst and Fieldwork supervision coach at Greenspace Behavioral Technology. Doctors, it's great to have you back.
Thanks for having us.
So National Autism Awareness Month, it is certainly a time where we become more aware of our neighbors, our friends who are on the spectrum. But more specifically, we're talking about a behavior that I personally have never heard of before called stimming. What is stimming, Dr.
Sure. So that is basically a behavior that someone with autism might engage in that's going to help them cope with their environment. This can be when they're feeling anxiety, when they're excited, when they're bored, and it's going to be more rigid and repetitive that ends up maybe interfering with opportunities to engage. So examples that you might see out in the community could be like hand flapping, rocking, pacing, or even lining up items. But we want to make sure that everyone understands that these are individualized behaviors that are going to look different based on the person.
Yeah, and what are some of the other characteristics? Because they actually sound like things that people who are not on the autism spectrum disorder do.
Yeah, for sure. So I think the important thing is expanding the conversation during awareness is that everyone actually does self-stimulatory behaviors and we don't even realize it. Like we may do our version of body rocking when we're standing, twirling our hair, nail biting, fidgeting with our hands. And so everyone has a version of like self-stimulatory behaviors, and most of the time they're harmless. And I think defining difference in individuals with autism is the intensity and maybe the way it looks. But the reasons why anxiety, fear are pretty much the same, or boredom or whatever. So it's like kind of functionally the same. It just looks a little different.
Yeah, and so, you know, people who are very functional, who are on the spectrum, so they also do this. And so for a coworker or a friend or an acquaintance, and then they see this behavior, what should one do, think, feel?
That's a good question. So one of the things also in expanding is just the idea of like when you come across something that may look a little different, is kind of tapping into, is it relatable to you, right? And so like a point of mindset of shifting is like, what's wrong with that person? Like we're always looking at the shift of what can I do a little differently, especially in the culture and climate we have now where there's a shift for compassion, is maybe saying, okay, is that relatable at all to me? And the answer is yes, self-stimming is, and then can you shift and say that person maybe just be having a bad day? So as an opportunity when you come across it, shift your mindset from what's wrong with the person to, hey, maybe they're having a rough day. Another thing, like Kerri said, sometimes it can look really intense in the environment. If you come across it, for viewers who may come across it, it's an opportunity also for you to demonstrate actionable compassion, which is like maybe someone needs help. So could you approach someone, in a very compassionate way and say, may I help you? Do you need support? And then giving them time to respond. So just two things we wanted to share with viewers are just shifting mindset to that person's just having a bad day versus what's wrong with that person.
What happens though if some of that stimming, that self-stimulatory behavior is self-harming in some way? You know, and what would an example like that be? I mean, if you're actually pulling chunks of hair out or things like that,
Yes,
right?
And that's a great one. And I think we can even just take that back to even the general population with those, that some behaviors can be so extreme. With our population, we'd want to follow those same steps of how do you get support medically? How do you get support therapeutically? And it's a great way to kind of bridge us together. There's such a push right now on acceptance and finding common ground. And we're all going through life and we're all experiencing these emotions. This population might outwardly process it a little bit more. So to look at it and go, hey, I sometimes feel just as anxious. They might just be overtly showing it differently. And like Zahra said, how can I maybe support them in the moment or one of their family members in the moment? But then just to have more compassion overall and find that common ground and go, I might have anxiety too. The way I deal with it might look different, but we're all having the same emotions.
Would you say that the pandemic had something to do with that behavior coming out even more in just all of us?
Right.
For sure.
Right. Because a lot of us felt very isolated at times and just kind of like you don't know what to do with yourself.
Yes.
Yeah. So this is a way that people can really relate to each other even more so. So compassion, at least, is the one good thing maybe that came out of this whole situation. And as therapists, as doctors, so if you see that stimulatory behavior becoming self-destructive or becoming too much that you're not functioning or you're starting to get outcast, how do you work with patients to maybe either subdue it, calm it down? What would you recommend?
So that's a really good question. I think for like just more generically, like we would, in our field, we would do something called functional behavior assessment. So it's a very specific assessment process that's individualized, that we look at why the person's doing it. So let's say you were nail biting, and you'd be like, Zahra, I'm bleeding. And I would come in and want to assess you and look at the conditions in which you were like doing that behavior, and then I would come up with a replacement or like something that would give you something else to do so that you weren't harming your body or your physical environment.
Transferring your attention.
Exactly. Just something else. Another coping skill, like a tool, something else for you to do that's functional and adaptive.
Very good. Now, for anybody who's watching this who wants more information, how do they find the both of you? Let's start with you, Dr. Krauss.
Sure. So the company is New Horizons Therapy, and you can find us at newhorizonstherapy.net.
Wonderful. Dr. Zahra?
Yes, Greenspace Behavioral Technology, greenspacebehavior.com.
Great.
Thank you.
Thank you so much, ladies.
So
Thank you,
much.
doctors. Appreciate your time. We're back after this.